Hi, I'm Moriah Facktor. I'm a trainer here at Heiser Health, and I'm going to take you all through a pregnancy workout. Obviously, you can see I'm pregnant right now. So, just before we get started, obviously check with your doctor before you do any type of physical activity, but for the most part, exercise is pretty safe when you're pregnant. You can usually just keep doing what you're doing and then make modifications throughout. The most common one everyone hears is lying flat on your back. You can do that early on in your pregnancy, but it mainly just gets pretty uncomfortable as you get bigger and bigger and puts more pressure on those arteries and veins. So you can either lay on an incline bench, you can use a stability ball, or just prop some pillows underneath your back when you're doing any type of lying down exercise. So I just got a short warm up to start, and I'll take you through modifications as we do it. So I'm just gonna start with some basic jumping jacks. So I can still jump when I'm pregnant, there's nothing wrong with it. So I've got 30 seconds to jumping jacks. If it is uncomfortable to jump when you're pregnant, you can do some marching jacks and just slow down your pace, or you can take the jumping out of it completely. Then after you do that for 30 seconds, then go into toe taps. So same thing, you can just find a stool at home, or you can just pretend there's something there, imagine it. You can go nice and slow, or if you want to get your heart rate up a little more, you can pick up your pace. Same thing, it's all safe, it's just whatever's comfortable for you. So you got 30 seconds of toe taps. And then after you do your 30 seconds of toe taps, you go into mountain climbers. So same thing, when you're in any type of like a plank position when you're pregnant, it can get a little uncomfortable, especially as your belly gets bigger. So I like to just raise up on an incline, and that's how I modify. Obviously, the higher up you go, the easier and less pressure it's going to be on your abdomen. So you can do it here. And you can even do some crossover ones. You can increase your speed, or slow it down. If it's uncomfortable even to get in any type of bent over position, you can do mountain climbers even standing up. And same thing, you can pick up your pace. You got 30 seconds of those. And you'll go through that 2 times. So it'll be 2 sets of 30 seconds of all 3 of those exercises. Then after you finish your little warm up, get the heart rate going, you're gonna go into your circuits. So I have 2 circuits, and I'm just gonna take you through the exercises in each circuit once. So the first one is band pull-aparts. You got 15 reps of band pull-aparts. You can get a band at Target, TJ Maxx, Walmart, anywhere they're really, really cheap and good for on-the-go workouts. Say if you're going out of town for work or travel, they're really easy to pack in your suitcase or your backpack. So put your arms shoulder level, keep the arms straight, and you bring it right to your chest. So from the side, it'll look like this. You're pulling right to your chest, so not up above, not down below. You have 15 of those. Squeezing that shoulder, those shoulder blades together. After we do the band pull aparts, we're going to go into a leg workout. So obviously your balance is going to be a little off when you're pregnant because your center of gravity has changed. I still do some single leg stuff. You can either do an isometric lunge. So you can just take your feet and go straight into a lunge like this. Hold on to a countertop, the back of the couch, anything at home to help with your balance if your balance is off. If you have pretty good balance and you want to make it a little more difficult, you can prop your foot up on a stool, on the couch, whatever you have available to you, and just do a rear foot elevated split squat. That's going to make it a lot more challenging, but as long as you feel safe with your balance. So you got 5 to 8 of those per side. Just do the other side. You're going straight down with your lunges. You never go forward. You gotta protect those knees. And just don't go down very far. Usually you want to go down where your knee touches the floor. When we're pregnant, we don't have to do that. Okay, so next thing we have are incline push-ups. Same thing, it's uncomfortable for me to be flat like in a plank position. So I do them on the back of the couch at home. You can do them on your countertop, on the wall, wherever you need to. And you just go down and back. Now here, my hands are together, and I'm doing more of like a tricep push-up, so it's gonna work my triceps more. If I were to go on a wall, your hands are gonna be at chest level, and you'll push. So make sure your arms aren't up here. A lot of people do their push-ups that way. So you want your hands pretty low when you do a wall push-up. You can do them flat on the ground if you want. It's just uncomfortable for me at 35 weeks now to do that. Okay, so after we do our push-ups, we have 10 to 15 reps of those. We're gonna go into squats. So pretty much the way to modify a squat is just don't go down as far. And squats are really good when you're pregnant because they sort of help open up our pelvis and get us ready for birth. So if you have a band, you can add the band and it'll just add added resistance. And you'll go down and back up. I put on here to do 15 reps. You can make that more or less, however you want to do it. So, another way if you don't have a band to make it a little harder, you can do a squat where you tap the ground and then you come all the way up and raise up on your toes. It's going to be a little challenging on your balance. And as you get bigger, your hands aren't going to be able to touch the ground, which is fine. But you're just going to go up. This one's going to get my heart rate up a little bit more because I'm going to go faster. And I'm moving through a larger range of motion. So last one in that circuit are pelvic tilts. You can do these standing. You can do them in quadruped, like a hands and knees position. Stability balls are really great when you're pregnant. They're about $20 at the store, so I'd recommend getting one. I'm going to show you first how to do it and get a better position, how to do it on the stability ball. You don't want your knees to move at all, it's just your pelvis moving. And you tilt your hips forward and back. It's a really, really small range of motion. So I'm going from a neutral position and then I bring my hips forward. And again, my knees are not moving, so I'm not rocking back and forth on the ball. We don't want that. But this is great for low back pain. It protects your back, it strengthens those muscles so you don't get as bad of back pain. So anytime you do have back pain, this is a good exercise to do, but it's also good just to help strengthen those abdominal and trunk muscles. And you can do that for about 10 reps. Then you can go into circles. So you're just going to do the tilt, but you're going to come in a circle with your hips clockwise and counterclockwise. Might be a little hard to see, but they're really, really small movements. And my knees, again, aren't moving. It's just my hips moving. And I'm just using my abdominal muscles to move. So it's all my transverse abdominis doing the work. And then I'm going to go the other way, 10 on each side. So you got 10 of the pelvic tilts, and then 10 circles in each direction. Yeah, you can do those in standing. So in standing, it'll just look like this. And hands on the hips. Just be like a little tilt. And my belly's moving, so it's gonna look like I'm moving more, but I'm not. I'm just tucking my hips under, and I'm tightening my abdominal muscles. And then another position you could do it in is in quadruped. For me, it's not very comfortable right now to get in that position, but a lot of women pregnant like to do exercises in this position. So just be tilting your pelvis like this. Again, I don't want to tilt down because I'm already in that position when I stand because of my weight on my belly. So I want to be neutral and then tuck under. Again, I'm using my abdominal muscles to tuck under. It's the only thing that's moving right now. So you can do it in that position, and you can do, the circles will be a little harder in this position, so I would stick to just the pelvic tilts in that one. So it's a really good exercise for low back pain too while you're pregnant. So after you do that, all those exercises, you can do it again. You can rest and then do it all over again as many times as you want, depending on how long you want your workout to be. And then I'll move into that second circuit we've got. So First exercise, getting that band back out and working on our biceps. So you're just gonna step on your band, put 1 foot or 2, however you want. And you're gonna curl up and down. Show you from the side. You want your elbows to stay close to your body, so we're not swinging. I don't want to work on my other muscles, just my biceps. And if you need to make it harder, you can bring them further apart. And it'll add more resistance. Same thing, you know those pelvic tilts I had shown you before. I want to keep my abs nice and tight during the exercise. My back isn't arched out like this, my butt's not sticking out. Everything's tucked in and tight, so that'll protect my back and my spine. So, after you do 10 reps of that, we'll move on to the next one. You can either do, we'll stick with the band. I put 2 on there, so you can do good mornings. You just take the band, bring it up overhead, show you from the side, hinge down, and back up. Again, moving those hips and back nice and flat. Or if you want to make it a little harder, you can try to do a single leg deadlift. So like I said, I still do single leg things, but I was doing them prior to my pregnancy, so don't try these if you weren't doing them before you got pregnant. But same thing, you can hold if you have weights, hold weight, but if we're at home or on vacation, we don't have any weights, it's still going to be a really good exercise to do without anything. You go down until you feel a pull in your hamstring, and then you pop back up. And again, I'm tucking my belly, so as I come up, I'm tucking my hips in and tightening up those abdominal muscles to protect my low back. And you're just going to do about 6 of those on each side. It doesn't take a lot. Okay, our next exercise, we're going to get those triceps. So with a band, you can actually do a decent amount of tricep stuff. You just want to find like at your house, if you have like a pole at the kitchen or something that's stable, you know, in your basement, you can wrap it around and you can do, hold it, don't hold it at the handles, or if yours is just one without handles, hold here, and then you'll just kick back like this. You got your tricep kickbacks you can do. If you don't have anything, any band with you, you can do dips. They're a good one, good exercise that's not going to require any type of equipment. And you can also do just an overhead extension. You can do one arm, or you can do both, however you want to do. There's a decent amount of tricep exercises you can do with the band or without it. So you have 10 reps of those, and then we'll move on to the next exercise. So, we have hip thrusts, or some people call them bridges. I do them on my stability ball at home. If you don't have a stability ball, you can do them on your couch. You'll just lay your upper back on the couch, and I'll show you how to do that on the bench. But you're gonna roll forward. If you have weight, you can set it on your pelvis. I do it with weight. If you don't have any weight with you, if you're on vacation, you just do it that. So, you're gonna squeeze up and back down. This ball's a little high for me, so I want it a tad bit lower, but it works pretty well. So same thing, I'm squeezing my glutes at the top. And you do 10 times, and then after you finish the 10th, you're gonna hold it for 10 seconds. So you just sit there and you'll squeeze your butt, hold it for 10 seconds. Once the 10 seconds is over, take a break, and then hold it again for 10. Just since we don't have any weight, increasing the reps and then adding in that hold is gonna get your glutes a much better workout. So, to do it, say on like the back of your couch, or you are at the gym and have this, bring that down. And same thing, you put your upper back on the couch, whatever it is that you're doing it on, and you come up and down. So same thing, after you do those 10 reps, you hold it at the top. My belly is tight. I'm still tightening my belly throughout all my exercises I'm doing. That's a good hamstring one to do where you don't have to lie flat on your back. Or glute one, you don't have to lie flat on your back. Okay, last one for this circuit are side planks. So again, for me, the plank position is not very comfortable right now at 35 weeks. I could do it pretty early on in my pregnancy and then it just started getting more uncomfortable. So I don't do those. I do push-ups and things like that in an incline, and that's how I get my core working. So side plank, you're just getting a side plank position. You can either come all the way up if you want to, or you can drop down and modify to a knee and leave this leg off the ground. If you want to make it harder, you can get those outer hip muscles working, or you can rest it on the ground. Again, remember you're driving your hips up towards the ceiling, so don't let them sag down. You want to pull them up towards the ceiling. And then you will do that for 30 seconds and just switch to the other side. And I'll attach a little paper that goes over tips and things with working out when pregnant. But one of the things is you don't need to work your core, you hear a lot, and that is true to some degree. You don't need to work your rectus abdominis muscles, so those six-pack muscles when you're pregnant is just pointless. But that doesn't mean there's other abdominal muscles that you don't need to work. Your transverse abdominis muscles sort of wrap around your belly like this. It's our natural belly brace. So those are muscles that are really, really important to work when pregnant and just to keep activated when you're doing any type of exercise. So after you finish those side planks, we'll go into a cool down. Again, you can do that circuit as many times as you want. But for the cool down, we're just going to do some basic stretches, and I'll show you different positions to do those in. If you can still get on the ground in a seated position, we want to stretch our hamstrings out. That's really important. You can do them like this, just sitting and reaching. The main thing with the hamstring stretch is get your pelvis set still in. So I'm not rounding my back, which you see a lot of people do. I don't want to stretch my back muscles right now. I'm just trying to get my hamstring. So I'm just tilting my pelvis and reaching forward. And you should feel a nice pull all the way up your leg. You do that on each side. Now, to stretch your back, which is a muscle you want to stretch when, especially you're pregnant, it'll get really sore, is quadratus lumborum, and it sort of runs all the way up here. And how you would do that would be to come across, like you're reaching that right arm towards your left foot, and you'll feel a really good pull all in your lower back. If it's really uncomfortable to sit when you do these, you can do them standing up. Same thing. To get my hamstring, I'll show you from this side. And again, you can prop your foot on anything, a chair, a couch, whatever you've got available. And I'm just sort of tilting my hips forward. That's all I have to do. I don't even need to lean forward. I already feel the stretch, just tilting my hips forward. Bringing your toes up towards you will also get a bigger stretch down lower. So you can bring your toes towards you. And then if you want to add in that quadratus lumborum, so that upper back or lower back, then you would go in and just come right here and do that, and you'll get a really good pull all along. Here, I'll show you on this side. And so I've just come in, and then I'm feeling it all along my spine right here. And that muscle gets really tight during pregnancy, so it feels really good to stretch it out. Okay, after that, basic quad stretch. All of you all have probably done that before. And again, your balance is off when you're pregnant, so hold on to something if you need to. But knees together, shoulders forward, hips forward. So no, knees way out here. We don't want any of that. We want it all nice and straight. Ready for this side. And try to keep that belly tight. Hips tucked under, so I'm not like that, arching my back. And then I added some upper body ones just because that's what was included in the exercise. A pec stretch is really good to do after you do a lot of push-ups. So you can just go to a wall. And probably get right here. And just put your arm at a 90-degree angle. Get your shoulder and your elbow at 90 degrees. Step forward with the same foot. And then you just lunge into the stretch. And you can even turn a little bit away from it. And you'll feel a really good pull in those pec muscles. And then you would switch sides. You can do this on a doorway, so you can just put your hands on either side of the doorway and step through it. I feel it better doing it one at a time. It's just whatever you have time for and whatever feels better. And then obviously you can do, since we worked our triceps, you can do a tricep stretch, which again you'll have probably all done before. Where you go down like this. Hold them for about 30 seconds if you have time to do that. It's great to do after a workout, especially with pregnancy. So that finishes up our pregnancy workout, a short one to do at home or while you're on vacation. You all have a great day.